All right, it is 8:30 here on a Wednesday night on the East Coast, afternoon for the West Coasters out there as well. My name's Eliot Hu. I'm from the University of Massachusetts Chan Medical School. I'm happy to moderate this session on unexpected medical leave. We have two excellent speakers today, but before I introduce them, just wanted to remind everybody that this is the AMSSM Sports Economics webinar series. If you have any questions, please put it in the chat. Please mute your microphones, and we will get to them as soon as we can, or as soon as we find a relevant break in between. We are planning on hosting other topics via the webinar this year as well. So please stay tuned for any of that too. So without further ado, I'd like to introduce our two excellent speakers today. First up is Maggie Doe. And so she currently serves as the Chief Athletics Health Officer and head team physician for the University of Oregon Athletic Department, where she oversees the medical care of 550 student athletes. She is also the chair of the Big Ten Athletic Medicine Cabinet at the conference level. Prior to her role at Oregon, Maggie held the head team physician position at the Ohio State University, where she also completed her fellowship in sports medicine. Maggie graduated from Loyola University Chicago, where she earned a Bachelor's of Science degree in biology, graduating magna cum laude while playing Division I soccer, where she was named the most valuable player in 2011. Following her studies at Loyola, Maggie attended Des Moines University College of Osteopathic Medicine and completed her family medicine residency at St. Joseph Spooner Family Medicine, where she also earned the Thomas Kail Dedication to Primary Care Award. In her free time, she enjoys skiing, hiking, and camping with her partner and her two dogs, Dottie and Piper. Our second speaker here is well known as well. This is Dr. Monique Burton. She is a clinical professor in the Department of Pediatrics and Orthopedics and Sports Medicine. She is a board-certified pediatrician with certification of added qualification in sports medicine, and she completed her pediatrics residency at Children's Hospital Oakland and a primary care sports medicine fellowship at UCLA. Dr. Burton was the chair of USA Track and Field Sports Medicine and Science Committee from 2013 to 2024 and has been a volunteer team physician for international teams since 2005, including the 2024, 2020, and 2008 Olympic Games. She serves as chair of the AMSSM DEI subcommittee and is on the board of King County Play Equality Coalition and School of Acrobatics and New Circus Arts. Dr. Burton enjoys all aspects of physical activity, sports, exercise, and movement medical care. Outside of work, she loves spending time with her two daughters and training partner in group acrobatics. Without further ado, I'd like to welcome our two speakers, and please, Drs. Doe and Burton, take it away with unexpected medical leave.
Awesome. Yeah, thanks for the introduction. I don't know how Monique feels about that. I always just feel very embarrassed about my bio being read, but thank you so much for that, Elliot. And yeah, Monique and I are gonna talk a little bit about what it's like to have to take unexpected medical leave. And she and I were chatting right before this and thinking about there's a logistical piece of this, I think, which is, how to take leave, like logistically, what does your state leave options look like? What are the short-term disability options? Those kind of things. But I think there's also like the real human experience of taking medical leave and the process of doing that and being able to ask for help and extending care to oneself, not just to the patients we care for. And so I think Monique and I will probably hit on a little bit of all of that. I'm comfortable sharing a little bit about maybe my story because maybe that'll help to just kind of level set the rest of the presentation. And then Monique, I'll hand it off to you. And I tend to be a talker, so feel free to cut me off when needed. But I'm family medicine, sports medicine trained. Started my job here at the University of Oregon almost a year and a half ago. And about a week before I had yet met the year mark at the University of Oregon, I got diagnosed with metastatic breast cancer. And so definitely a life-changing diagnosis to receive. Definitely like an out of left field in a lot of ways. Had no family history, and was feeling pretty normal other than feeling a breast mass. And so went through the process of neoadjuvant chemotherapy, and then just had my mastectomy about 6 weeks ago and returned to work this week. So you'll see in the background, some of the athletic trainers had put up a welcome back sign for me. And my last name is Doe, so the joke is just Doe it. So I'm back at work full time, but doing a little bit of like a staged return, which I think Monique and I will talk about too. So anyway, big life changes. It's the first time in my life I'd never taken a sick day in my life, I don't think. And in my entire career had not taken a sick day. So to go from that to needing almost 7 months off from work, I learned a lot about that process and about myself. But that's a little bit of my story, which I think will help level set what I learned, and I'll pass it over to Monique.
Well, thank you for sharing and being open to sharing that too. I do think it's like really helpful to kind of understand that like we have things that come up too, and how do we take care of ourselves, and just appreciate you being a part of this. My story is really different. It was an injury. And so on September 14th, actually, as you heard when Eliot shared about what I do, I do circus arts. And so for my like fun and my hobby, I was a gymnast growing up. I do partner in group acrobatics, and had actually kind of just started to do more of the group acrobatics, and was my second week of that. And we were doing something called teeterboard. So teeterboard, for those who aren't circus fans, looks like a teeter-totter, a seesaw. And you stand on the low end and people run and they jump and it launches you in the air. And so it was our second week of doing it. First week went really well. I should show a video. It's like very exciting. Did a backflip onto somebody's shoulders in a spotting belt, of course. And so the next week, I mean, I would say this is the classic like story that we hear from our patients. It was like the end of practice. There was another group coming. We didn't have very much time. And one of the kind of coaches or supervisors of the group was like, we have enough time, just go ahead and go for it. Like get in the belt. And like, I was like, felt a little bit rushed, but I was like, okay, it's so much fun last week. And I get in the belt, and I would say that the flaw in all this is that we hadn't done a lot of timers and stuff for it. And it went so well before that there's like just like probably not enough preparation of really understanding the danger and the risk of the teeterboard. And and we decided we were going to do a double back this time. And so two people were going to jump and launch me. And so what I remember very distinctly was that I was on that side and I was like, oh, I'm kind of not in the right position. There's a very nuanced timing where like, as they're running, you have to like slightly lean back. So you're perpendicular with the teeter board and it launches you. And it's really important not to hyperextend your knees. So as I was kind of like in position, I was like, I could tell I was a little bit off, and in circus yards, like just stay tight. So I just stayed tight. And like, I think literally as a moment, as I said to myself, just stay tight, but don't hyperextend your knees, is unfortunately when they launched me. And because of my leg hyperextending, it really forced it into hyperextension. And I had a very bad tibial plateau fracture that I actually have on video, but I will spare you guys all of that. So really significant pain. And I luckily was in a belt and put down and came down and just was like, something bad happened, and contacted my sports medicine colleagues at University of Washington, since I'm at a pediatric facility, and it was like something bad happened. And luckily just the relationships with them were able to connect me. I went to like a little one of those little pop-up urgent cares, mostly to get my crutches in to get an x-ray, and saw it right away and was able to get connected with the trauma surgeon, and had surgery 2 days later, and now I own a titanium plate and a bunch of screws in my leg. And so that's kind of where my journey started as far as like FMLA. So yeah, I'll pause and we can kind of go from there as far as kind of building upon like what came next.
Awesome. Yeah. I imagine, Monique, that your story is especially tough because it all happened so quickly. And like, and even with like my diagnosis, I still had some time to plan before needing to take leave. So while it was definitely unexpected, I think I certainly had more time on my side to figure out like what I wanted to do. Whereas I would imagine those decisions were happening a lot quicker with that. So Monique and I just talked about just some talking points, and so we don't have a PowerPoint or anything like that, but thought we could just go through some of the most important things that we learned through the process. So I think the first one, which maybe we'll probably spend the most time on, is like the real human experience of like physician culture and being a physician and the barriers that there are to just asking and taking leave. So I think, a few bullet points, and I'll let Monique jump on this one too, is just I think there's guilt wrapped up in needing to ask colleagues for help. I think there's, much like we see with our student athletes, when they become injured, there can be this sort of loss of identity. I think probably a lot of people on this call and a lot of people in medicine feel like most of their life has been wrapped up in sort of that sequential medical training. And so I think feeling a little bit of like identity loss of not doing the normal things that you're used to doing every day and the career that you've worked so hard for. I think definitely again, the guilt, but the fear of like burdening other people was a big one for me. And how am I going to find coverage for all the things that I do on a daily basis? I think there's also a little bit of some personal culture amongst physicians to just push through illness, and much like we see our student athletes do. But again, I think big thing I learned was sort of being able to use the things that I'm telling my student athletes of like, hey, you have influenza A, which is rampant right now. We need you to take a day or two off from for practice and competition, and them not wanting to do that and realizing that I was then applying that same thing to myself. So like not wanting to take time or wanting to try to work through as much as I could. But I think extending that idea of care to oneself is something that maybe we're not used to as physicians or maybe not comfortable doing. And then I think just learning a lot about like that self-care is professionalism, which I think is a AMSSM wellness principle. So taking care of oneself is actually really a healthy thing to do. And it's also safer for patients too. So I think there's a lot of like patient safety stuff that you can wrap up in this. But I also think there are a lot of institutional barriers to leave too. And some of those institutional barriers I think come from training, but I think also come from working in likely under-resourced departments, and under-resourced in medicine in general. So I think there's a lot of like physician like personal barriers to wanting to take leave, but I think there's also a lot of like systems things at play too. Monique, I'll let you jump on if you have more.
Yeah, I mean, well, and again, thank you for sharing. And I would just say also, because I think we're all physicians, right? And like we immediately have a desire in some ways to like minimize our story. And I think that I'm trying really hard to also like just embrace it. Like I've had a lot of experience of like, well, like it's just a broken bone. Like I'm going to get better. Like, why am I having such a hard time with that? And like also accepting that like there's many reasons why this like just broken bone was really impactful in my life, but everybody's story for the reason they need to take leave is different, and everybody's story really matters. And so like I just say that also to honor you, Meg, because your story is very different than mine, and my recovery will kind of end, like, and your recovery will also, but will be different than mine too. So and I just feel like really strongly of like sharing that to all of our members, right? Because I think like if there's one thing that I can like hopefully share is it like it's been really hard to accept taking care of myself, and a lot of guilt with that. So like I guess I'll just kind of start from when I first got injured and I like was wrapping my mind around like this is bad and I'm gonna have to have surgery, and I can't believe I did gymnastics for 16 years and I never broke anything, and I'm now like injured as an adult. It's my right leg, so I can't drive. And like I am am a solo parent and I have two children who need to be able to accomplish their goals, and a wonderful set of parents who help me a lot, but they're 80, like, so they're going to have to like, unfortunately, like step up. And like, all of this is going through my mind of like, how in the world do I do this? And also thinking about like, wait, how do I do my like call, and like, I'm going to be gone. And like, what do I tell them? Like, how long am I going to be gone? And so that initial kind of just like, okay, I'm not going to be there. And the guilt of like, I'm in clinic tomorrow, like, and it's Sunday night, and like, I'm obviously not going to be there. And like having those brief moments of like, or could I like try to do some, no, I'm not going to be able to do telemedicine like the next day when I'm in a lot of pain. And so I think that like I spent a decent amount of the first part of like my injury, just like trying to figure out how to like match my current state. And I honestly, like I was in so much pain, like honestly, probably the worst pain that I had ever had, that like I was very aware that my brain wasn't functioning the way that it normally did. But I also knew that like the normal me was like, what is wrong with you? And that was very disturbing to me also, that I was like not functioning well. And I knew I wasn't functioning well, but I couldn't get myself to function normally. My daughter had her like 13th birthday, of course, that week too. And I was trying to do her party and couldn't order things because I was just like, I couldn't complete a task. And so that was like a really big first awareness too of like, I shouldn't be taking care of patients, even if I wanted to, because I wasn't going to do a good job, because my brain actually wasn't working very well, because it was managing all this pain, despite how much I wanted it to. And then I think I went into this mode of like, really trying to figure out like, well, I kind of know the timeline for this because we do this, right? And like, of course, I have like this thing that we do, and I knew too much, but not enough about, because I'm also not a surgeon and not a trauma surgeon for sure. But like, what is the reasonable amount of time before I can go back to work and function? And like, when they're asking like, should we cancel these clinics or those clinics? And just being like, I don't know, but wanting to like, think I could come back, I think earlier than I really could. And very, very grateful for my colleague, who's our section head, who was like, I'm just going to call it for you. I'm like closing your clinics for at least 3 weeks. And like, we can revisit this in a little bit. And like, I'm putting a hold on everything, but I'm just calling it because there's no way. And it was such a relief to have somebody who just made that call for me, because I was not, what I thought I could do at that time was very different than what I learned over the weeks of what I could do. So, but I also like then instantly had this like, oh, like maybe I'll write a paper, or like, I've always wanted to like write up this like work that I'm doing in this clinic and like make these connections, or like start a podcast, or like, who knows, like reorganize my house. And like all those things were things that I like started to think that like maybe I could do. And then I started like have trouble, because I was like, I can't do these things because I feel like I can barely like tolerate the pain when I'm awake. And that then was like hard, because I felt guilty that I wasn't at work. I felt guilty that I couldn't function. I'm like comparing myself to like an imaginary person that is a sports medicine doctor who I'm thinking like probably is doing all these things, when in reality, I just needed to focus on healing. And it took me, and it still takes me, time to reconcile that like the biggest lesson I could take away from this experience was that like it's really hard for me to let myself heal. And like, if that's what I need to learn from, like, I try to learn something from every experience that is challenging for me. If that's like my takeaway, is that like I need to learn that sometimes I need to not to do things and to heal. Like that is like hopefully what I can take away. And then also really like, who's in my corner, who's going to help me, and that it's okay to ask for help, and those people want to help you, and like to speak up and to like accept that help. Those things are really hard to do, and I had to like allow myself to accept help in a way that I wasn't used to. But and also just really like a huge appreciation for those people who were helping, and like remembering to say that and to be grateful that I have those people in my life. So, but there's so much more I could say, but I'll kind of pause with that kind of just initial like, whoa, like my mind was like in like a loss and like, how do I like, what do I do next?
I was taking notes as a little bit of some notes as you were saying that, Monique, because so much of what you just said resonates with my experience too. I think the big one that stands out to me is like one, I think as a and I can speak for myself, but I think probably many physicians fall into the category of sort of achievers. And so like I know I've spent my whole life, including medical training, right? Like trying to achieve what the next thing is, medical school, residency, fellowship, job, leadership position. Like we're constantly trying to achieve. And it took me talking to my mental health therapist to be like, Maggie, you're also trying to achieve cancer right now. Like I was trying to like be the best at cancer. I was trying to like, do as much as I can at work and also get chemotherapy. And she had to, really like level set me and say, like, this is not a time to achieve. In fact, you could probably learn about yourself a lot through like not achieving cancer. So I think like a lot of what you stated, Monique, resonates with me in terms of like it's hard to kind of get out of that mindset that we're like trained to be into. And then the biggest thing I think that resonated with me was having a supervisor or a leader that stepped in and helped me make a decision on what I wanted to do with work. And as a leader and as a supervisor of athletic training staff and behavioral health staff, it was a great lesson for me of like I could return that favor to someone someday. Like my supervisor said to me, you've done probably your whole life is care for other people or like extend that idea of care to others. And this will be the first time in probably a long time or maybe ever that you've had to extend that principle back to yourself. And I remember being in a meeting where we were trying to figure out what we were going to do with my leave and how to figure out coverage. And she was just very much like, you can be as involved in this process as you'd like, or you can say, I don't want to be involved and I need to take care of myself. And that kind of ignited me to come up with like what my goals were moving forward, not for my career, but my goals for like me as a human and like what I wanted to get out of like the process of going through cancer treatment. And for me, my goals were to uh, complete treatment, stay out of the hospital. And with those two things, especially during chemotherapy, with those two things being like knowing that those were my goals, I knew that I wasn't going to be able to like come in and see sick student athletes all the time. Like I wasn't going to be able to expose myself to the things that might not allow me to achieve those goals of taking leave. And so it took my supervisor though, and my therapist saying like, hey, Maggie, I think it's time to take a step back and like be as involved as you want, but there's no pressure or expectation for you to be involved. Like you need to prioritize your own health and well-being. And so that really resonates with me, Monique, that you had someone in your court that, was also doing that. And I think that's something I will extend forever as a leader moving forward is if this were to happen to someone that I supervise, that I'm helping them to prioritize their own wellness because we're all in healthcare, whether we're an athletic trainer, a dietitian, a behavior, like we're all going to probably have similar mindsets. And so sometimes as the leader, you got to be the one to step in and say like, time to prioritize yourself. So I think those two things and being transparent with my supervisor up front was really helpful for me. That might not be the vibe of everybody going through like a significant, medical thing to relay all of your medical information to your supervisor. But that I had a really trusting relationship with my supervisor, and that ended up being really important was like transparency with that person pretty quickly and upfront because it actually allowed me to find space to care for myself better.
Yeah, I really appreciate like you saying that. I mean, again, I'm just so grateful that I luckily have a colleague supervisor that is just like super thoughtful and understanding and knows me well enough to like kind of be like, I need to decide for you right now. And even said like, I don't want to decide for you, but do you need me to help you with this? And like was able to do that. And then each step of the way to really be able to say like, how much do you want to be involved? I'm willing to like say everything or you can say it. And so I just like really have so much respect for her being able to step in that role. She had recently stepped into this role and to be able to be such a great leader and kind of really even just solidify that even more in my mind, how much appreciation I have. And I also just wanted like to highlight another thing that you said is that like thank goodness for like, yeah, my mental health provider. Like I remember her saying to me at one point in time, like, I said, I know that I really couldn't do work because I know that I'm like, I wasn't really my normal self. And she said, and do you feel like you're your normal self now? And like that you're functioning normally? And I was like, it was, you know, I think I was maybe 2 or 3 weeks into my injury. And I was like, I mean, I guess I thought so. And she's like, yeah, I mean, not quite. And I was like, it was interesting because like in the moment, I was like, I'm doing pretty good. I feel like I'm functioning well. And she was able to kind of be like, no, you are like not your normal self, like in a kind, respectful way, but also helpful because I've known her for a while. And it was really helpful to have somebody kind of also be like, no, you're not really functioning the way that you normally would be. And I would also just say like my physician, my surgeon was really helpful in the sense that his wife is also a physician, and he's like, I know your personality. And he's like, let me say this multiple times. Do not do too much. He's like, you have to let this heal. Do not do too much. And actually, like at my like 8-week follow-up came back out and said, I want to say this one more time. Do not do too much. You have a very big injury and it needs to heal. And the most important thing you can do right now is work on your motion. And he's like, so, and I think it was very validating for me and really helpful to have somebody like, I guess, like, yeah, like validate that like this was bad. And it wasn't just me being kind of wimpy, you know, especially because when we have athletes who have tibial plateau fractures, all different sorts, and some are actually like, I realized like not that bad. And some are like just as bad. And like, I think I questioned like why am I like, why does this hurt so bad? Like, and you know, why can't I move my leg? Like I learned so much about like it's funny to say this out loud. It's because we all like do this in sports medicine, but I'm like, I just thought I would power through. I'm like, you know, if I try really, really hard, I'm going to be like the best PT person ever. And I'm not going to lose any motion because I'm going to like not let that happen. But it actually doesn't work that way. And so like, you know, I think that like that was this super amazing learning for me is that like, yeah, you can't like be a star at PT and like make things happen just because you want them to. Your body has to heal itself also. Yeah, I think I have so many more emotional things to say. I mean, we can talk a little bit about I don't want to miss talking about some of the logistical parts. So maybe I'll like, it's okay, Maggie, if I say some of that stuff about FMLA. So I'll just share a little bit. Like, I would say I'm fortunate because I'm part of an institution, right? So like taking FMLA and paid leave was maybe easy in some ways for me because I'm a part of a university. They send you the information, you fill out the forms, and boom, there you go. But filling out forms and sorting through information when your brain is not functioning well and you're like paranoid that you're going to do it wrong and somehow you're going to like mess up your FMLA was like the component that I found really challenging. And they have it very detailed. And I realized it was like so much detail that it was almost too much detail for me. But luckily there was like a really wonderful person in the HR who I like emailed far too many times and met with because I was like, are you sure? Like, I'm sure I did it right. Like, what if I do this? And what if my doctor changes the end date? And what if I decide to change to intermittent leave at a different time? And she was very like, that's fine. You know, you just do it. And so I would say just on that note of filling out paperwork, like hopefully if this ever happens for anyone, you're at a place where you have like a go-to person who you can bug. Like, I mean, I think I learned that too, is that like, I need to know that I feel comfortable in what I filled out. So I'm going to ask this person questions and verify like more times than like maybe like I needed to make sure I felt comfortable in it. And also understanding that there's flexibility to it. And like, if you like mess up and you're like, oh, I actually thought I'd be better by this date and I'm not, you can extend it. I mean, there are rules, right? We have 90 days and those are 90 days are what they are. And like, my 90 days, I didn't surpass, like, at least so far. So like, I didn't need to go into it. I think some of what Maggie can talk about. as far as like short-term disability or like unpaid leave and things like that. But I would say having a great HR person, and then honestly, like being an advocate, like we were talking about this before, and unfortunately, like I'm dealing with a little bit of like reconciling my FMLA now, and like, you know, reconciling like how much clinical volumes I will need to like do to get to my end of my academic year, and have alignment in one of the clinics I am and not alignment in the other. And I realize it's very much triggered a lot of emotion for me. Like it brought me back to the like feeling like defensive of like but I had to take this time, and like, you know, it stirred up a lot of emotion just around the whole having to take the FMLA, that like I had to kind of check myself over the past couple of days of like, I know that I'm allowed to take FMLA and this person's understanding isn't accurate. And my reaction right now is because of all the emotion around the injury and having to take it. And this will get solved, but knowing that like there's still healing to be done around the reason for taking it. So, but I'll let Maggie share, because I think your story's different as far as what you had to take.
Yeah, no, and I think that all of that resonates with me, what you've described too. I think one of the like most important things I learned up front was that FMLA offers job protection, but not every state offers paid leave that's associated with that. So I did a quick Google search before this presentation, so hopefully this Google search is accurate, but I think there's only 13 states in the US that have a paid program for like medical leave. And so luckily Oregon, where I work, is one of those states. So I was able to have my family medical leave run concurrently with the paid leave that I was getting from the state of Oregon, which meant I was able to keep all of my like job protection and benefits, and also get up to like 60% of my, it's not a full, so you don't get 100% of your pay, but you get 60% of your pay through the state paid medical leave program. So I think like that's important to know up front, is like, what is your institution's policy? Is it just FMLA? Do they have other policies in place? What are the state level options? So knowing that there was a paid program in Oregon was like a really quick decision point for me. And then I think the other things that kind of like start to layer into that is like, when do you take short-term disability, and do you apply your short-term disability from the institution, from your employer, or do you have a short-term disability plan from like an outside insurance group, like a State Farm group? And when do those things, is there an elimination period that's associated with those disability programs? I also learned that with the short-term disability, and just to level set my experience, I decided to continue doing 60% of my job, which was the administrative portion of my job, throughout the entire time of my treatment, which ended up being like very manageable, but I eliminated the 40% of my clinical duties. But I think that's important up front too, is like knowing and maybe even negotiating at the time of your employment what your job description is, and having a really good feel of that. Because for me, it ended up working out quite well that I was able to sort of do this work from home job and still get paid 60% of my salary to do that, but able to get coverage for just the 40% of my clinical time. And so I do think like it made me realize how thankful I was to have negotiated my administrative time up front in my job, because it ended up impacting what I was able to do when I had to take an unexpected medical leave. I would also say with short-term disability plans, like I had a plan that was institutional. So I had like a University of Oregon short-term disability plan. I also had a disability plan through State Farm. Interestingly, through State Farm, you have to be 100% disabled to be able to use that plan. So because I was still working 60% of the time, I couldn't apply that benefit. So I think that's just something to think about when you are thinking about a leave and you want to stay partially working. Sometimes there's a benefit to not doing that, right? Like sometimes there's actually benefit to just taking the whole leave, right? For your wellness, but also potentially financial impact for that as well. So I wasn't able to use any of my state farm disability. Plus there was like a 30-day elimination period. Some plans are like 60 or 90 days for an elimination period. What that means is like at the time you apply for your short-term disability, you have to wait somewhere between 30 and 90 days for that to kick in. And so with that timing, it may or may not make sense depending on the reason for your medical leave. And then interestingly, my institutional short-term disability had a cap on it, and they assess your paid medical leave through the state as part of that cap. So even though I applied for like the short-term disability through my university, those paychecks were only like $25 a month because I was like already capping out the 60% from the paid medical leave. So I think these are all things to just potentially think about when you're getting a job, honestly, and like what are the benefits, what are the things that you can expect with taking a medical leave. The other thing that I think about too is this will be a question like if I ever have another job down the line, I think a very specific question that I will ask of my new employer is like, how do you handle unexpected medical leave? Now, and I would have never asked that question unless it had happened to me, and it happened to me. And I feel honestly generally very grateful for the way that University of Oregon handled my leave. I never felt pressure to like do more than I needed to do. They've been really good on my like return to clinic and how we're kind of like grading that back in. But I think asking that question even at an initial job interview, and I don't know if we have people that are transitioning on this call, if we have people that are transitioning to a new job or maybe new grads that are like looking at jobs, I think it's a really important question is like, what are the systems in place to help cover if me as the new employee were to have an unexpected medical leave? Because I think it tells you a lot about the systems in place to cover that. And whether or not there are redundancies and whether or not there are systematic support for someone if they have to take leave. I felt really lucky here that taking the leave, we were able to, get the 40% clinic coverage like pretty easily. And a lot of people like really stepped up. It put a lot of burden on the fellow that we had this year. And it required one of the doctor that was that retired before me to come out of retirement and help with clinic. But he was happy to do that. But I think it's a question that I would probably think about asking anytime I'm interviewing for a job, because I think it tells you a lot about the system or lack of systems in place for covering you when something like this happens. We never think it's going to happen to us. I literally never, I think I was floating through life thinking like, honestly, this privilege of like health and thinking that I was just going to coast through the rest of my life with that privilege. And, it hits you out of nowhere. And when it hits you out of nowhere, you want to make sure that you're at a place that's going to be able to like support and cover you appropriately. So anyway, one thing I just think about here is like a potentially a piece of advice to anybody looking at new jobs or new grads is like, you might ask what the plan is if someone has to take unexpected medical leave, because it might tell you a lot about how much support and resources are in place for that kind of thing. The disability stuff is really, short-term disability is really complicated, but hopefully I highlighted, knowing what your university plan is, if you have a plan outside of that, what that looks like, that there are elimination periods, so to be considering that. And then a lot of times these disability plans have caps, and the cap might be affected by any paid leave that you might be getting from the state.
I just have a quick question for the both of you, because I think it's important that you both highlighted that there are institutional policies, institutional plans, and then state plans as well. Because my question is, did you both have to burn through your personal leave first before you can go to FMLA? Because certain institutions require that as well. So I just wanted to put it on everybody's radar. And then what was your experience in kind of going through that?
Yeah, great question. I did not have to, so I was able to keep I didn't have to spend any of my sick leave. And I think it's really nice. And I think that, I don't know if that's specific to University of Oregon or the state of Oregon or how, but I did not have to spend my sick leave. I will also say though, I was brand new in this job. I had only been here a year, so I had only accumulated something like 80 hours of sick leave. So like, I wasn't even going to have enough to cover me, you know, being out for a few weeks. So yeah, mine, luckily I did not have to spend my sick leave.
Yeah, ours is like kind of arranged in a different way. We have like an expectation that we're going to work like a certain number of weeks per year times our clinical expectation, and then everything else is in a bucket. And so that includes conferences, vacation, uh, sick, you know, whatever it is, it's all in the same category. And like there's a recommendation to how you're supposed to send it, right? You're supposed to do some amount of CME and some amount of vacation and whatnot. So because of that, like no, that's all still in that's own separate bucket. And they actually were just talking about this, that they really encourage people who have a medical reason or some reason that they're going to be out for more than 5 days to apply for yes, FMLA and paid leave, because that I think it just protects you, and I think it protects them better. And so, and they don't want you to necessarily use that other bucket. So, but you're right. I don't think that's true everywhere. So I feel like grateful that that was actually true. And I think I've had, you know, and I've wanted to stay in my paid leave bucket of 90 days. And so that's created some level of paranoia. Like I definitely, like I actually like have a very complex spreadsheet that like mapped out every day that I was planning to take, and like when I could fit in PT and like what that would look like. And you know, like I guess I wish I didn't have to do that, and I could have just done like, I tried to think like this is what's best for my body. And I asked my PT and I asked my doctor, like, you know, like how long should I be in PT twice a week? And how long should I be like, you know, gradually coming back to help guide me? Because I would have really messed it up had I like predicted it early on, because you know, like I was 8 weeks completely non-weight bearing, and then I was another 4 weeks of gradually returning to weight bearing. And again, it was my right leg, so I couldn't like, I didn't do any of the like, people would be like, just drive with the other leg, and like I just was like, my doctor actually fortunately said, don't do that. Actually, I don't want you to do that. If you crash, you're going to be in trouble. And like, and again, guilt. I was like, maybe I should be driving with my opposite leg, and like, why am I being so wimpy? And but I'm glad I didn't, because I had trouble getting in the car anyways because of my leg. But in trying to map out that plan, I think I did a decent job, and I had kind of a phased return with like coming back like a couple days, and then now actually this is my first week of like having a full week of clinic back also. And I wouldn't have thought where it would be like right now is where I am. Like people are like, are you okay? And I'm like, I'm fine. I feel like I can be back. And it hurts. Like, I mean, I just didn't think I don't know what kind of magic I thought was going to happen. I thought like I'd be like getting stronger and working on motion maybe, but not pain. And so that part has been like interesting to like be limping at the end of the day and try not to limp, you know, and yeah. So I think that like, because I've been so kind of maybe paranoid about that 90 days and not wanting to dip into it, because just financially I can't do that. I wanted to make sure that I stayed in the 90, and then actually that I kept a little bit in reserve just in case, because after having a crazy thing I didn't expect to happen, I didn't want to like use up everything, so that if some other crazy thing happened before my year of 90 days came back again, that I didn't have like a little bit left. So I have like, I don't know, something like 16 days left. You know, I'm sure at the end of the academic year, I might be like, darn it, I wish I used that. But I also like now have some level of anxiety around like the unexpected happening that I didn't used to have.
Yeah, 100%. I feel the same way about that. I had a lot of anxiety around like spending my 12 weeks of leave and then like potentially having a complication or something where I needed to take more time, and I had only built up 80 hours of sick leave because I hadn't been at the job for very long. So like I think those are all like anxieties that resonate really true with me too. But you just try to plan the best you can and kind of see where it falls. But I think yeah, I think it's all a big learning process about, you know, what your like personal support for yourself is going to be, your institutional support, and then what the what the even like state support is going to be too. So all these things I would never have expected I was going to learn in 2025 and 2026, but here we are. Hopefully some of that is helpful in terms of what to ask for and what to look for with your employment.
Definitely remember that state part, because we were just talking before that I totally messed that up. I was like, it's like free money I think I missed out on, but like not free, because actually you're paying into it. That's why you have it. But I just like, and it was on the thing of like things to do. And I just like, that did not register for me as like, that was like something that you should do. And it was like on the list of all the different things to do. And I was very much into like, let me make sure I follow the rules and do these things. And I was like, that thing seems different. Like, I didn't think I was eligible for that because that seemed like somehow different. And then another colleague of mine who was actually out on leave was like, did you do that thing? And I'm like, what? And so I would definitely advocate for that for other people, because it is something that you're kind of paying into, that you have access to, that I didn't really utilize, which I wish I had. So, and I was just also going to say that, because I think we're both in sort of different phases of this, of like our return is also utilizing those people who like care about you, and utilizing your supervisors to help you. Because I still like will have conversations with my colleague supervisor who's able to say like, in very wonderful, validating ways of like, of course you're still like having discomfort, and are you actually able to do what you've decided to do, or do you need to change it, and how can I help you? And I think, sometimes what happens when somebody has an initial like diagnosis or trauma or whatever it may be, is that there's a lot of like early interest of like, ooh, what can we do? And quite honestly, I didn't know how people could help me. So I did a lot of like, I'm fine, I'll be okay, I have my mom, and now I would say like, gosh, I wish I had said, yeah, I need snacks, because I actually like, I was on crutches and I couldn't like, I had hilarious moments in my kitchen where I was like going to try to get food. And I was like, how am I gonna like, I can't grab anything. And like, I'd stand in front of the refrigerator and like try to eat something really quick before the refrigerator bell went off. And then like, so I just didn't end up eating as much, because I was like, I couldn't get myself things. And so then later on, I'm like, yeah, I guess I should have like asked for help, like, or like really like thought about it, and taken it like for things like that. And like, I'm trying to, again, like I said earlier, with every experience that is challenging, I try to ask myself, like, what can I learn from this? And I think for me, like learning is like, when people care about you and they want to help, like letting them help you. When you're coming back to work, finding those people who are your advocates. And not everybody is, actually. Some people are confused, like, why did you need, like, I heard you hurt your foot. And I'm like, no, actually it wasn't. But like, like, you like, what are, like, how do you find the people who are your fans? And quite honestly, I've also learned to like, I'm horrible at this because I care a lot what people think about me. And I've tried really hard to also learn that there's some people that I don't need to care as much about what they think, because they're not there for me. And like, how do I start to like really focus in on these really wonderful people who have been champions for me and really helpful, and the people who maybe aren't people that I need to expend my energy on, whether they're at work or they're like in your personal life. So like, that's been a takeaway. And then I mean, of course it's been a takeaway as a physician and doing what I do. It's just like really having an appreciation for what pain does to you for your patients, that like they may be trying as hard as they possibly can, and their motion may still not be great, like, but they really actually are doing a good job. And then just interesting things like that, I think are, again, really patient relatable, like a recovery process of like, when I think about our patient population and like caring for athletes, and like the impact that I feel like it had on both like my like physical, but like really big on like the emotional part of my life in the connection to physical activity. I feel like I've always had a lot of empathy for my patients, but this has built an empathy in a different way that is very relatable. And like, how can I take this experience to like have a deeper and more empathetic connection with my patients and their families for what they're experiencing, and advocating for their mental health as they're like recovering, and putting systems in place to be able to really do that. And then I guess, I don't know, I'll stop talking in a second, but really huge new awareness of the lack of like, I guess I want to say the lack of support and like universal functioning for people with disabilities. I was kind of astounded by how hard it was to navigate around on crutches. Like sometimes amazing, easy, people open doors, we're doing really wonderful things. Other times people like, I think actually are annoyed with people who have a disability and like want to skirt around you in a way that almost makes you fall over. Yeah, like was at my daughter's concert and like there was no seating for people who were on crutches, and I then became very well aware of the elderly people who were like in the back row almost getting knocked over by students. And so just like the heightened awareness of like people who are living in chronic pain, some form of disability, and what they're navigating on a daily basis. And then when they come into clinic, like the pain they're experiencing, the challenges they're experiencing, and like, goodness, I mean, of course, that's going to be even more on top of their diagnosis than we even like really realize. And so, and so many more things, but I'll pause there.
Yeah, that's really interesting insight. Yeah, you made me think of a couple of things with the sort of like return to work process. I do feel like from my perspective, this was one piece where I feel like being a sports medicine physician, maybe specifically in an athletics department, but being in sports medicine really played to my advantage with return to work because everybody understands a return to play protocol. And my shout out to Heather Halseth, who's our director of athletic medicine, our head athletic trainer here. And she was like, we're going to do an RTP for you, return to physicianing. And it's going to be a graded process. And so she was kind of advocating for me to my supervisor about like this graded structure of getting back into the clinical care and clinical work. And so, so I do feel like in some ways it's an advantage to be a sports medicine doctor and coming back from leave, because people here, whether it's a athletic trainer, a student athlete, a coach, an administrator, they all kind of understand the term of like return to play. So I'm in my return to play phase right now and like slowly building up clinical care. So I think that's one thing I was thinking about with returning to work after medical leave is like, it really shouldn't be a 0 to 100, right? Like that's not the world that our student athletes live in. And it's not the world that we live in as their care provider when we're coming back from something, whether it's a significant injury or whether it's a medical illness, right? Like we also need to have a graded return to what we do. And again, it's extending that idea of like what we tell our student athletes, extending that same principle back to ourselves. And so just wanted to give a shout out to sports medicine, shout out to my people here for giving me a graded return, but also to keep that in mind if this ever happens to somebody where you're taking an extended leave, it really shouldn't be a 0 to 100 return. And so I think like working with your supervisor, and again, transparency with my supervisor up front was really helpful with that. And I don't know if I just got lucky because I'm at the University of Oregon, but I felt a lot of support in terms of like doing that sort of graded return. So something to think about too as you come back from leave. And one other benefit that I thought about as we were talking about FMLA and short-term disability and paid medical leave, for anybody that's still on student loans, if God forbid you were to get a cancer diagnosis, this wasn't like made public to me. I just happened to kind of like find it, and I was figuring out how I was going to pay my student loans while being on a reduced salary. There is a cancer deferment for student loans, and so you can have your loans deferred for the time that you are on chemotherapy. So for me, that's technically a year where I can have my loan payments deferred, and they count towards public service loan forgiveness. Which I'm doing, which I'll be. That's what I've been told. So I cannot confirm if that has actually like gone through, if they're going to count my 12 months. But in talking to my loan servicer, which is Mohila, I was reassured that those cancer deferment months can count towards public service loan forgiveness. So just one other thing to think about as you're like planning for an unexpected leave and how you're going to pay your loans during that time.
Yeah, if just to interject, because I just had my 120 payments for public service loan forgiveness. This happened like last year, right after we bought our house. And so I'm like, oh, good. But yes, there is medical deferment, but I would encourage everybody, I mean, this is off topic, but I would encourage everybody to save screenshots and document everything, because if they say, well, you know, we didn't ever said that, and you didn't document it and you didn't have keep records of it, you're never going to be able to get those 12 months back. But, you know, I remember I was lucky enough and good enough to keep all those records. So basically when I said, oh no, you guys told me this, and they said, and this was like 10 years ago, and they're like, well, prove it. And then I said, here's the email that you guys sent to me to prove it. And then they're like, oh, we counted it. Yeah, so they're like, oh, we're going to count it. So yeah, go ahead, Monique. Go ahead.
Oh, I was just gonna kind of reiterate what Meg was saying about the, like, strongly recommend that if this, you know, if something comes up in your life that you are out from a medical reason, then definitely do the gradual return. And like she said, we do return to play really well. And so like you can map it out. And I do feel like I was like grateful. Like I questioned myself a lot of like, do I really need this much time? And like, thank goodness, like I like kind of like did more than I thought based off because my PT told me. Because it's really important, because you know, you want to fully recover. I mean, your goal is to fully recover, right? And so like whatever you need to be able to get yourself that full recovery is really important. And like some of the treatments and the management of whatever the issue may be are pretty critical in certain time periods. And so like, don't cut yourself short because you're feeling like, oh gosh, I really should go back to work. And if you're wrong, then change it. Like if you turns out you're like, gosh, you know, I thought I was going to be ready to go back at whatever time, then like you really do have the flexibility to like change those dates. And you know, there may be changes in the way that your leave is working, but I think that gradual return is really helpful. I didn't realize how tired I would be actually. I keep on thinking, I'm like, gosh, this is just who my new normal is. And I'm like, I used to work this much, but it seems really hard. And we all know that after a vacation, like it's hard to come back, but like when you're returning and you've had a like big life event and you may still be getting treatment or you're still like having pain, your body's still trying to manage that. Plus, like it makes you realize how hard we work and that how much your like tolerance we have built to manage what we do, and that takes some time to be able to build back to that. I don't feel like I'm my normal self yet, but I hope that comes. So yeah.
Yeah, no, thank you both for this. I do want to leave some time for question and answer. So for those who are still on with us, please put your questions in the chat, and I will ask the questions of our speakers. But just to kind of wrap up a little bit, I know both of you mentioned a lot of institutional support that you got while you're returning. I'd like to play a little devil's advocate. What if you don't have that support? How do you really go ahead and advocate for yourself?
Well, I will admittedly say that I don't think that this is my strongest area personally, but I have through this experience learned that there's like we know if it helps to like think of yourself as like a patient that you're helping, then do it that way. And like, what would you recommend for that patient? And what would you recommend for your best friend or your parent or whoever it is that you feel strongly about, and do that for yourself. And even if that means that you're like, I need to take off these days because this is going to help me recover most. I think it's a matter in some ways of letting go of the guilt of saying that this is what I'm going to do. And like, it's unfortunate if you don't have that support, because I think that there comes like this like backlash, but remember that like, this is what you would do for your best friend, and choose to do it that way. This is what I would do for my patient, or, you know, ask somebody what they would do. Like I asked my doctor, forget I'm a doctor, what do you recommend I do? And that really helped me. And so I think that like, if you're not in a situation where you have that support, then remind yourself to ask that question. And even though there may be backlash, do what's best for you.
Yeah, I think some of the advocacy can even come before you're employed. So I think just not to repeat it, but I think that idea of like asking the question when you're in your job interview of like, what do you do in the case of a extended medical leave? Like, how do you support that person? How do you find backup coverage? So I think advocating for yourself up front when you're interviewing for jobs is important. I think also just one other thought, which may not be a full thought, but just that like I 100% agree with Monique is that the idea of like, again, extending the care principle back to oneself and like, what would, if this was your colleague happening and your colleague had a, a tibial plateau fracture, like you wouldn't expect them to be back in clinic, right? At 3 weeks, I think like, or if you had a colleague that, had a cancer diagnosis, like I think you'd want to help cover and help support that colleague, right? So just like thinking about those things and applying it to yourself, I think we have a hard time doing that as physicians and as healthcare providers. I also think that like if you're having a really hard time like getting institutional support, I do think it can become a patient safety issue. Like, and so maybe using language like that, if you need to force the idea, is important because I'll speak for myself. I mean, when I was on chemotherapy, I was having so much nausea and vomiting that they put me on like 4 different anti-nausea medicines, one of which was like an antipsychotic, as Zyprexa, and like I could not have done my administrative work. I could not have done clinical work being on those medications. And it would have been a patient safety concern. So I think like reframing things maybe in that mindset can help too to try to advocate. But I think I really love what Monique said about like kind of letting go of the guilt around it and letting go of that burden and just extending that idea to yourself. Like, what would you do for a colleague? What would you do for a best friend? And realizing that people want to show up like that for you too. And hopefully there are systems in place where that doesn't feel like a huge burden to that person that's, taking that on because there's, adequate coverage and resources to help with that.
Yeah, I think both of you hit on a lot of important topics kind of throughout the talk too. I think Monique and Maggie, you both mentioned, you know, there are times where you really identify who truly are your friends at work and who truly aren't. Yes, those are acquaintances that you work with, but really in times of distress are really when your friends will show up and kind of back you up as well. So I think using that relationship and
Yeah.
allowing yourself to use that relationship, because we never want to bug our friends with all this stuff, but really in terms of economics and kind of moving up in the world career, I always tell my trainees, don't be afraid to shake your tree of contacts. They're contacts for a reason, they're networks for a reason. Don't be scared to shake it when you need to. And so definitely in times of stress, I would definitely encourage everybody to shake it and see what falls out. But certainly, yes, there are those administrative strategies as well that Maggie alluded to. But I also wanted to point to, really understand what your legal rights are in terms of the state, in terms of federal rights. If you understand that, and let's say the institution is in clear violation of that, you could potentially, hopefully it doesn't get down to that point, but pursue legal services as well. I'm not pushing everybody to do that, but I'm saying we really need to understand what our rights are. And if institutions are taking advantage of us, then we really need to kind of advocate for ourselves. Which leads me to my second question. We all mentioned a lot about the burden and the culture that's being established. I think this will be the last question here because we're running short on time. And so we touched upon that physician culture. And we, all of us, including you, Maggie, and Monique, have kind of touched on, well, we don't really want to burden everybody else. We kind of feel guilty about this. But a lot of this, we're saying, well, we. I really wanted to get down to the root of this is, what do you think, or who do you think created this culture? And what do you think are the stakeholders that are involved to continue this culture?
Yeah, I mean, I actually kind of discussed this question with my partner, who's also a physician. She is an emergency medicine physician, and I think, man, the culture of emergency medicine physicians taking sick time is like on another level, because it's hard to cover a 12-hour overnight shift, for somebody else. And we were talking a little bit about why we think that is, and I think part of it stems from medical training in some ways, and I think that has certainly improved and evolved over the years. But I think we're kind of like it's a learned behavior of like, you put in a lot of hours, you work through illness because that's just part of learning, I guess, and part of like the training. Like, I think it's just like an expectation of like, how we're trained kind of in medical school and in residency. So I think some of it comes down to that. We talk a lot about wellness. I think like I remember my residency program really trying to focus on wellness, but it makes me think about wellness being really like the systemic variables at play that allow for wellness, right? Like it's not so much um, it's not so much the program that you do 1/2 day a week in your residency program where you can, socialize with people, and that's also important. But I think it's also like advocating for physician wellness in terms of like the systems and the resources in play at our places of employment. So I think the stakeholders are, I think a lot of it can be learned behavior from the way that we're trained and that sort of sequential process that we go through of intensive medical school, residency, fellowship, and then going into high clinical load jobs. Like I think it becomes a little bit of a learned behavior, but that's not necessarily on the physician, right? Like I think some of that comes down to just the systems at play with training, and then what is wellness? I think like wellness to me is like advocacy at the institutional level at the state level. About having protected resources and the ability to cover people when medical leave occurs. Like that's wellness to me, is like learning to advocate for those things.
Yeah, I would echo everything that you said and won't repeat it all for like just the sake of time. I definitely think like highlighting again, like being an advocate, like, like if you have an experience like this, like where can you like be in the room or join a group or like be a part of the conversation that is advocating for, all that wellness means, which isn't just that you should do it yourself. And then I think being a role model for it. And so, I mean, I think we have an opportunity as physicians when we're mentoring other people to like really live that, right? And so like, sharing the story of like, I took time off because I had this injury and I took off this much time because that's what it took to heal, so that when somebody else has the same experience, they aren't like, oh, like, am I going to look better if I come back on crutches and like I can't make it through the day? Like, like, how do you like model the behavior that you want to try to like really advocate for in the future? And I think also like being mindful of like if somebody has something going on, like having a conversation with them and advocating for them to do what they need to do to heal or to care for themselves or their family the way that they need to. And so like being a part of that change. And then, yes. And then of course, modeling that for our trainees. And then, yeah, I mean, it's still very uncomfortable for me to sometimes be my own personal best advocate, but like, I'm learning to step into that discomfort and like, ask for and do what I need to like get to where I want to be. So yeah, I think it's those things: speaking up, supporting other people, being a good role model, and helping others break that cycle. So.
Yeah.
Yeah,
totally.
no, go ahead.
Sorry, go ahead.
No. Why don't you go first, and then I'll conclude it.
Sure. Yeah. First, I was just going to say I saw Dominique's comment about blaming it on capitalism. Yeah, 100%. You and I can get coffee sometime and talk more about that piece. But yeah, I think the modeling of like that was a big thing that was brought to my attention too. Like even with the return to work processes, like model the behavior that you expect of your student athletes. And so, and I think the same thing applies to talking about trainees as well. So I just was just going to resonate with what Monique said.
Yeah, I think it's important when everybody has mentioned too, especially really trying to advocate for yourself and breaking out from that model. The whole reason that I asked that question was that I think the main point is it's not all on us, and we have to accept that. It is sometimes the system. It is sometimes the historical training that we came from. But there's a Chinese saying. They call it altruistic kidnapping. And so basically, they are kidnapping your time. They are kidnapping your personality. They are taking advantage of it, taking advantage of our altruism and our commitment to our patients. And sometimes we just have to say no. And I've had difficulty doing that myself as well. And I remember this was about a year and a half ago when my wife tripped on the stairs and broke her metatarsal. She's a physician as well, but she works from home. But I had to drive her and pick up the kids to medical appointments and then all that. And fortunately, I was already, I would say, quote unquote, mature enough that I would just tell my work, nope, I'm not doing this. I got to go and pick up my kids. Nope, I got to go take my wife to to her medical appointments. I'm not going to do this. And so I'm going to take sick leave. If you want me to take leave, I'm going to take sick leave. If you are letting me, just go, good for you. Thank you for that. I appreciate it. But no, I am going to advocate for myself and for my family. And so I think it's important for all of us to kind of find that balance. It's going to take time. It's going to take experience. It's going to take some guts as well. And so I think it's important for all of us to realize that it's not all on us. It is also a part of the system, capitalism, if you want to say it that way. But I think it's on all of us and everybody else too. And specifically on wellness, there are organizations out there who just puts resources out there for you to use. And then they say, okay, yeah, no, we provided all these things, but you still have to advocate for yourself to use them. So don't be scared to use them. They're there, use them. Or, they say, oh yeah, we have some, these resources available, but we still have to set that up. That's not really wellness. Yeah, you're in the process of doing it. You got to set that up, or sometimes you have to advocate for yourself. So thank you both so much for sharing your personal stories. It's certainly great to hear all of that as well. I'm sure everybody can relate to that somehow, some sort, not necessarily in terms of, let's say, personal injury or cancer diagnoses, but certainly there are personal stories with everybody that can kind of resonate and relate to this as well. But this will be recorded as well, or it's already being recorded. It will be on the YouTube channel for AMSSM in the next coming days as well. So thank you, Maggie. Thank you, Monique, for sharing your story again. And thank you, everybody, for attending.
Thank you.
Thank you.